All right, good morning, everyone, or good afternoon, depending on where you are in the world today. Even good evening. Thank you for joining us for today's webinar, which is one in a series of virtual events that the Center on Global Energy Policy is hosting as a part of Climate Week NYC. My name is Melissa Lott, and I'm a senior research scholar at the Center on Global Energy Policy at Columbia University, where I lead the center's power sector renewables research initiative, including all of our work at the intersection of energy systems, climate change, and public health. This week, the center has already hosted events focused on different aspects of how we can achieve a sustainable, equitable, and just global transition to a zero carbon energy system. This has included a couple of events that you can watch online in the coming days because they were recorded, including an event on the impact of energy transitions on global health and economic prosperity, as well as an event on how to ensure an equitable, sustainable, and just global transition. Today, we will be simultaneously concluding our Climate Week events related to energy, health, and equity, as well as kicking off a series that will go through the rest of the calendar year that will focus on aspects of environmental justice as it relates to the energy system. And I would quickly like to thank a few people who have been involved with that. First, Richard Kaufman, who originally proposed the idea for the Environmental Justice Series here at the Center on Global Energy Policy, and who will be hosting our next event in October. And I would also like to thank Caitlin Norfleet, Nicolina de Mogensen, Artelia Gilliard, and Jenna Morton for all of their work behind the scenes to support these events throughout the week, including all the logistics and outreach. Thank you so much for your time and dedication to these projects. For today's discussion, we will be specifically focusing on the impacts of climate change and air pollution on our health, and highlighting the ways in which these effects compound existing inequalities exacerbated by systemic racism. The evidence is clear that climate change is already impacting our health today, and that mitigating and adapting to climate change represents the greatest global health opportunity of the 21st century. At the heart of the challenge and its solution is the energy system, which currently produces not only the majority of human-produced greenhouse gas emissions, but also the vast majority of key air pollutants that harm our health and the health of communities around the world. The evidence is also clear that while these health impacts are felt by everyone throughout our lives, the burden is not evenly shared, with poor and marginalized communities often experiencing a disproportionate share of these ill effects. As an engineer and researcher who's worked at this intersection of energy systems, climate change, and public health for 13 years, I'm really looking forward to this discussion with different aspects on the important topic over the next 90 minutes, or just a little bit less than that at this point. For that discussion, I'm delighted to be joined by three experts in the area, Dr. Maria Nira, Dr. Nicholas Watts, and Professor Dan Kamen. Their full bios are going to be online, and honestly, the number of amazing things they've done in this field, we could spend the whole time talking about them, but I'm just going to briefly introduce each of them right now. So Maria has been the director of the Department of Environment, Climate Change, and Health at the World Health Organization since September 2005. Throughout her tenure, she's led and advised on policy and management in key areas of environmental health. And among many other distinctions, she's been awarded the Medal of National Order of Merit from the French government and was named an extraordinary woman by Her Majesty Queen Letizia in Spain. In 2019, she was nominated to be among one of the top 100 policy influencers in health and climate change. Nick is the executive director of the Lancet Countdown, an independent and multidisciplinary research collaboration between academic centers around the globe that tracks and drives progress towards a world that is responding to climate change in a way that protects and promotes public health. He is also the chair of the National Healthcare System England's Net Zero work, leading an expert panel and analytical team at the NHS to determine how and by when they can reach net zero. He works to engage health professionals on the links between climate change and public health, having founded both the Global Climate and Health Alliance and the UK Alliance on Climate Change. And Dan is a professor at the University of California, Berkeley, with parallel appointments in the Energy and Resources Group, where he serves as chair, at the Goldman School of Public Policy, where he directs the Center on Environmental Policy, and in the Department of Nuclear Engineering. He is a founding director of the Renewable and Appropriate Energy Laboratory. In April 2010, he was appointed to be the first energy fellow of the Environment and Climate Partnership of the Americas Initiative, and in 2016, he began to serve as a science envoy for US Secretary of State John Kerry. He's authored or co-authored 12 books by my count earlier, served as the World Bank's first chief technical specialist for renewable energy and energy efficiency, and has testified more than 40 times in US, state, and federal congressional briefings, among many other activities. So to kick off today's discussion, we're going to start with the panelists speaking each for about 8 to 10 minutes, after which point we'll move to a moderated discussion, including questions from the audience. And I'll do a couple of quick housekeeping items. For those of you who are joining us via Zoom, you can submit a question for the panelists at any time by clicking on the Q&A button at the bottom of your screen. But for those of you who are joining us on the live stream from anywhere else, including YouTube, you can submit a question via Twitter using the hashtag CGEPLive and our Twitter handle @ColumbiaUEnergy. Now, before I hand it off to Maria for her opening comments, I'm going to quickly mention that this event is being webcast live and also being recorded, and the full video will be available at the Center on Global Energy Policy website in the coming days. And with that, Maria, if I can pass the baton over to you.
Thank you, Melissa, and very happy to be with all of you. Good morning, good afternoon, good evening for all of you around the world. I see that many people is listening to this dialogue, so I hope that I will be able to provide some ideas for what can we do. No need to tell anyone that we are facing a very exceptional, incredible times, very strange time. I must say that none of us we were prepared for it, but because of that, I think we need to be very strategic on the way we will be proposing solutions. And if you allow me, Melissa and participants, I will start with that part. I'm sure that Nick and Danielle might be able to give you more on the evidence on why we need to act. But I will start by the end, because I think we are in the middle of a critical emergency, so we need to be very smart here and prove that as a humanity, we can still use part of our intellectual coefficient to take some measures here. At the moment we are talking, many countries are preparing those stimulus packages, economic recovery packages, and we will see how our leaders, our politicians are able to use those packages in the right way or in the wrong way. What I can tell you is that if they use it in the right way, one of the most important beneficiaries will be human health. But if they use it in the wrong way, the damage for our human health will be dramatic. And that's why we need to make sure that wherever we are at university, whether we are politicians, where we are journalists from the media, youth, students, whoever is joining us today, please be aware that you have a role to play, any of us. It can be playing an influence on your politicians. It can be by grouping with all of people and doing more advocacy. It can be by reading all the papers that Daniel or Nick or others will be publishing or WHO, making sure that you are aware, you create a movement to pass this information, and you influence the way your leaders will be taking decisions, and use your vote as well to keep them in positions or to remove them. What are those decisions that they need to take? Well, you heard it. Climate change is affecting our health. Air pollution is affecting our health. Anytime I repeat this figure, I'm shocked. Anytime I say that there are 7 million premature deaths caused by exposure to air pollution, I'm shocked because of the number. But in the last months, I'm shocked as well to realize the number of people that they never heard that figure before. That was an incredible surprise to me when you talk to journalists around the world and they say, can you repeat that figure? Did you say 7 million? And they say, yes, I said 7 million premature deaths every year caused by air pollution. And it's very painful because many people still doesn't know. So we have a huge role here. The first task for all of us, make sure that you repeat ad nauseam this figure because many people still doesn't know. Second, make sure that you create a sense of responsibility, even among ourselves. It's not just to put in that figure on the table, it's if we have that figure, it's because someone is keeping our cities very, with a very intense traffic congestion, because our cities are very densely populated. It's because we are not here yet using the right sources of energy. We are using fossil fuels. It's because from some strange financial absurd discussions, we are still paying subsidies to fossil fuels. And it's still because we are destroying nature. We are polluting everything we touch. We are putting plastics here. We are, contaminating everything we touch, and we don't know how to handle our waste and our overconsumption. So, 6 prescriptions. WHO did what we call the Manifesto for a Healthy and Green Recovery. And we need all of you now to align on that. After all, it's nothing new. It's just a common sense, diagnostic-based prescription for recovering this patient that doesn't want to hear more bad news after COVID. The patient is traumatized, so they don't want to hear that, this was nothing compared with what will happen with climate change. So here are the 6 prescriptions. 1, recover your relationship with nature. Stop destroying environment and ecosystems, because even if it's just for a selfish reason, we need nature to provide us water, air, and food. So even if it's just thinking about yourself, don't destroy it. 2nd, provide the basic services, water and sanitation. I mean, it's incredible in 2020, I'm still saying that, but here we are. 3rd, please do this quick and ambitious healthy energy transition. We need to stop using fossil fuels. Fossil fuels, they need to be fossils again, and maybe going to the museums for us to visit it if as another fossil, and on a prehistoric time. 4, your food systems, we need to make it more sustainable from the beginning to the end. 5, mayors, urban planners, governors, stop creating cities that are not healthy, that are not livable for people. So we need to make sure that our urban planning is very good and protecting and promoting our health. We need you mayors as well to contribute to this, and the money has to go to that. And number 6, and I will stop here, is stop paying subsidies to fossil fuels. I mean, all of us, we have a responsibility on that, whether you are a citizen or a big prime minister. Don't give subsidies to fossil fuels, because they are costing us 5 trillion to treat the health consequences of this wrong decision. So you can invest your money very well, and we are on a critical moment. So I count on all of us, all of you, to make sure that we influence this agenda in the right decision, in the right direction. Otherwise, the consequences of this pandemic will be nothing, and we will have anytime a high vulnerability, and then it can be a pandemic, or it can be climate change, or it can be anything, because we are not putting the green walls that we need to protect our human health. Over.
Many thanks, Maria. I appreciate that. I'm going to hand it over to Nick.
Sure. I learned a while ago, you must never speak before Maria Neira, because the second she starts speaking, everyone will forget what you said, because they'll be so entranced by what she's saying. What I've now learned is you must never speak after her as well, because they may just spend their time wishing that, Maria, you were still talking. Nonetheless, we have 8 minutes or so from me. That's going to be fun. I have a presentation. People can see that? Fantastic. Vigorous nodding thumbs. Let's be quick, because I think the discussions will be more interesting than anything else we have to say, and certainly more interesting than my slides. I'm going to spend a few minutes. I'm going to talk about the work that the Lancet Countdown does. We are a collaboration. We do a simple thing. We put a finger on the pulse, the links between public health and climate change once a year. We work with world experts around the world. Core to some of this work, you'll see down the very bottom there. It's a small logo, but it should probably be 2 or 3 times the size of the others. It's the World Health Organization. Academic institutions, UN agencies scattered across the world. We agree on basically nothing, because that is, as a bunch of public health professionals and academics, I think that's what we are being paid to do, but that's never been made clear to me. We agree on basically nothing, but the thing that we agree on are the results of the annual report that comes out. It's 41 indicators. We spend an entire year working through the data. We pull everything together. It comes out once a year, and it's a way of tracking progress and also tracking the impacts that climate change is having on human health. 2 or 3 key things come out when we look at this. 41 indicators is too many to look at, and no one should really bother to read the report, but maybe we should pay attention to the couple of key messages. Up the very, very top, it is so clear. It is so clear from the research that we're pulling together. The life of every single child born today will be profoundly affected by climate change, will be profoundly affected by air pollution. Those 7 million deaths that Maria was talking about, they have faces and names, and they're growing up today in polluted air all around the world. There's a little hint at the bottom there, but without accelerated action, this is going to come to define the health profile of entire nations at every stage of human life. So what do we mean by that? 2 or 3 examples. Our data talks through some of this, and most of this is driven by the fossil fuel combustion, driven by the energy we're talking about. But our data talks through heat waves. We look at exposures of vulnerable populations, people with pre-existing sort of heart or kidney issues, people over the age of 65. We look at exposures of these populations to heat wave across the world. 220 million additional people exposed in 2018 compared to our climatologically stable baseline. If you take that a little further and say, yes, okay, heat damages your kidneys, it damages your heart if it gets too hot. It also stops your ability to work. Sometimes when it gets a little bit too hot, you're faced with a pretty difficult decision. Either you go out and you work in subsistence agriculture, in manufacturing and labor, or you don't. And if you don't, then you're going to suffer all sorts of health outcomes from sort of lost household income. What's really important about this map up here, which broadly mimics where we're seeing the vulnerability that's happening from heat wave, 2 things stand out to me. Firstly, there are a bunch of countries there and a bunch of populations that are affected by climate change that traditionally, historically, have had very, very little to do with it. You see it concentrate in Pakistan, we see it concentrate in Southeast Asia, India, China, across sub-Saharan Africa. That stands out to me, and that's where the majority of the burden here is. What also stands out to me is that no country is immune. This simultaneously affects all of us, but disproportionately affects vulnerable populations across the world. These graphs as well, I should mention, they track up to present day. Yes, climate change is a health crisis for 2050, for 2100, but it is also a health crisis today in 2020. And so when we look at the impact of climate change on crop growth duration, so global yield potential, we see 2.9% reductions in yield potential for maize globally, 3.8% for winter wheat. That's an enormous shift in global yield potential for staple crops like soybeans, rice. And it translates through, right? It translates through into the interactions between climate and other environmental systems, ecosystems. You see increases in the vectorial capacity for the transmission of dengue fever skyrocketing since the baseline that we take back in the 50s. We take a pretty broad baseline to get something climatologically stable. The second highest year on record was 2017. This data isn't published yet, but it's been peer reviewed and approved by the Lancet. 2019. Is our new highest level. That'll come out in a month or 2. This is getting worse on a day-by-day, year-by-year basis. And when you track this, not just for dengue fever, which this graph looks at, looking at the 2 vectors there, Aedes aegypti and albopictus, but you can also track this through for the Anopheles mosquito and malaria. You can track it through for chikungunya. Some of the preliminary work suggests you can also potentially track it through for Zika virus, coming from similar vectors. That is depressing, right? Climate change, it turns out, it impacts on human health in a direct way and an indirect way in many and very different avenues. It risks this multi-hit scenario where populations are hit again and again and again. What is more depressing is that this isn't new. Nothing I'm saying should really be new to anything here. Hopefully we're providing some interesting data to evidence some of that, but we have known about this generously. This says 2 decades. I think we've known about this for 3 decades. We have known about the health impacts of climate change for 3 decades, and broadly, the global response has been inadequate. To give you a sense, some of the data, and Melissa, I think you put this data together for us back in the initial years of the program, tracks the carbon intensity of the global energy system. Lots of things have happened over that period of time, right? You can see a couple of countries, a couple of groups there, United States, Northwest Europe, they have decreased the carbon intensity of their energy system since sort of the early 1970s, 1990. A couple of countries and regions have increased. We see Southern Asia and Southeast Asia and China, India in there as well. Along the same line, increasing the intensity. So that's interesting, but what is more interesting is the line that we have very helpfully made almost impossible to see. It's the dotted black line. It starts in 1990 and it carries through to present day. Broadly, the carbon intensity of the total global energy system has remained flat for the last 30 years, whilst we've been aware of these health impacts of climate change. So that's 2 depressing things, hey? Firstly, climate change impacts on the health of populations in a profound and direct way, fundamentally, we think, shaping the health profile of children's lives as they grow up from present day. We've known about this for 30 years. But I think just in the last 5 years, maybe just in the last 6 years, probably since the Paris Agreement came along. Maria, I think I've heard you say before, the Paris Agreement is the most important public health agreement of our time. I completely agree. What it does, what the Paris Agreement does, what the work that the WHO does, it shows us that a second path is possible, that you don't have to affect the life of those children in that way, that actually the response to climate change is fundamentally good for human health. It aligns almost perfectly. And if you do it in a way that understands the energy dynamics and understands the air pollution considerations we'll get into, you have these unprecedented opportunities. We are starting to see that, I think. I think there are reasons for optimism. We got to be cautious with our optimism, but we have to find it somewhere. This data here looks only at Europe, but we're working for 2020 on drawing this out across the entire world. It's a little complex, but what we're doing is taking 2015 and 2016, and we're looking at the progress Europe has made reducing its air pollution just in those 12 months. We're taking that through, we're looking at the health impacts of that air pollution, and we're counting up the lives saved as a result of that. And that's interesting. But what is even more interesting, and what really gets their attention when we start to have these discussions, is that just the advances that have happened from 2015 to 2016, they result in an annual saving of 5.2 billion euro from reductions in life years lost. That is remarkable. Europe wasn't even trying back then. Just wait to see what Europe can do when it really gets its act together. Unfortunately, we aren't quite seeing these improvements across the entirety of the world, but hopefully this gives us a bit of a sense of what is possible and a sense of the positive health effects and the economic effects that can result from that. Melissa, I've got to stop doing this, but this is also a figure I think you sent our way. This gives you a sense, it's a snapshot of what's happening with electric vehicles across the world. Since we started tracking this, I remember starting by saying, okay, well, listen, the electric vehicle transition is coming. It'll be quite a way away. We started back in 2012 looking at this. Over time, our narrative has changed to, oh, it's coming very quickly, to, oh, it's past us, it's happened. Electric vehicles around the world in different parts have reached cost parity with their non-electric counterparts. That is ridiculous. I just came from a meeting where we were talking about the United Kingdom's discussions to phase out the internal combustion engine, currently 2040. They understand that that is way too slow. The new discussion is really more about, should it be 2030? Should it be 2032? You know, or can we go further? There are some really exciting shifts that I think we're starting to see, and in both the energy system, sort of power generation and transport, things are moving faster than ever before. The final place where I'm excited is in the healthcare sector. And I'm excited about that because we know that when the health profession really gets its act behind some of this stuff, like it has in tobacco, like it has on vaccinations, on smallpox, HIV, and like it is currently around the world in COVID, the health profession has the ability to save lives and move mountains. This graph and our data here, it shows what happens when you plot along the y-axis there an index of healthcare quality. Along the x-axis, per capita GHG emissions. Okay. If we populate this with every country in the world, and I promise we will, and eventually we get to publishing this data in 2020, at the end of 2020, what you'll see is there's actually a bit of an inflection. Up to a point, about 450 kilograms of CO2e per person, there is a relationship between the healthcare you can provide and the carbon there. But that disappears and breaks down pretty quickly. And it turns out that if you are like the United States or like Australia, where I'm from, you manage to produce broadly similar amounts of healthcare, but with far, far higher carbon footprint. And it turns out that doesn't have to be the case. Across the world, there are some really impressive, really important things happening with the health profession. One of them, Melissa, you mentioned, the NHS is thinking seriously, really seriously, about what a net zero health service is. What a remarkable question to ask. What a net zero health service is, what a net zero hospital looks like, what a net zero ambulance looks like. I don't know the answers to any of that, but I'm pretty excited to try to find out. And it's kind of those three things that give me a reason for optimism. That, I think, is pretty much all I had. But I'm pretty excited to hear, Daniel, what you have to say, and then maybe we can have a fun chat.
Thanks, Nick. Appreciate it. And we'll pass it over to Dan.
Very good. So thank you all for being here. I really appreciate getting a chance to talk with the panelists, our hosts, and the audience in particular. That's the most fun. So I too will share slides. So I'll drop those up now and get us going. And assuming you can all see that well, it's really a pleasure to come to talk to you from California, sort of the new nexus of the climate apocalypse, where we've had orange skies, we've had heat waves, we've hit record surface temperatures. And so I'll post the slides I'll use here on the website of my laboratory, the Renewable and Appropriate Energy Lab here at UC Berkeley, or rail.berkeley.edu, and also they'll be available on Twitter. But the easiest way is via the website, the Rail site. So I want to start off with what's really set the tone for thinking about energy, health, and climate justice. And this is a billboard in my home city of Oakland, California. Now, you have to be a Californian to recognize the zip codes. They're one Hamming unit apart, meaning one digit separates 10 years of life expectancy. And we see that through housing quality, through air quality, through violence, a whole variety of features. And so recognizing from the beginning that the elements of our crisis, be they around direct energy use, be they around differential access to justice, all these things are with us today. And I live in one of these two zip codes. I live on the higher life expectancy side. This is also national data too. If we jump into some of the plots just for the United States, looking at the dramatic differences in life expectancy as you move around the country, you see places that have different levels of healthcare, different levels of clean energy. All of these play into this larger story. So when we're talking about the effects of positive investments on clean energy, climate, and social justice, we see immediate effects in our communities. This is not something we need to wait for some future climate day to see. It's with us now. And so it's with that I was happy to serve in the Obama administration as the science envoy. And so we worked with Secretary Kerry, with President, with some of the ambassadors like Dwight Bush shown here, on partnerships that weren't just about transitioning the energy system. They were also about recognizing these wider sets of co-benefits. And much of my work was both on how do we transition energy investments to cleaner ones. And we heard, I think, the most critical point from Maria in the beginning, that our fossil fuel subsidies are tilting this landscape against positive choices in incredible ways. And I'll come back to that number in the end. So we worked on a variety of these issues, and certainly at a meeting here in New York with the UN, the Sustainable Development Goals are a great place to start. As someone who works on energy directly, I certainly see all of these related to my own core one, Sustainable Development Goal number 7, clean and accessible energy for all, as the starting point for better schooling, better treatment of the environment, of oceans, of fisheries, of smarter agriculture. All these tie together. When you look at some of the areas where we know there are solutions that we can implement, one of the immediate ones that gets a lot of high-level international attention is the incredibly polluted environment in which people cook. There's been decades of effort to improve cook stoves. There's been far less effort on the social side to make sure that the education, the partnership programs to get cleaner technologies into people's homes is on the front burner. That's one of the things that I worked on in the Obama State Department in terms of health issues. And every now and then you see signs that these kinds of efforts to both work on the science and also work on the social science really pay off. And so one of my trips for the president to Zambia, you see things like this, where a vote for women into office is like a government without women is like a pot sitting on one stone. And so this really kind of highlights the degree to which we can see the connections. Our job now, with a very tight timescale, is to put these sets of anti-racist, pro-climate actions into effect. And so I'll try to illustrate some of these things going forward. So of course, one of the nice things about serving in an administration is you get a nice letter from the commander-in-chief. This is right before he left office. But unfortunately, in my case, I stayed on, and we did have a little election in the United States. You might have heard of it. It didn't go quite the way I would have planned. And the US really stepped away from leadership on all these issues: clean energy, health, social and racial justice. So of course, at that point, I did have to resign. And as you know, in the United States, when you want to communicate with our president, you send him a tweet. I tweeted out my resignation letter. I indicated in an acrostic and the first letter of each paragraph what I really felt. And I'm hopeful that in November, we can make the single biggest step back to really reinvesting in health worldwide. And I want to highlight that because we've learned a great deal. One of the clear topics around the world is that housing policy is climate policy, is social justice and racial policy. Places that do not invest in affordable housing near areas of work are essentially relegating lower and lower income employees to live further and further where we work. In California, we have some of the lowest income employees commuting an hour a day into Silicon Valley for the best jobs. This is also true in parts of Mumbai. This is an issue in Sydney. This is a worldwide phenomenon. If we recognize this connection, funds spent on affordable housing near places of work are also climate policies, and they're also social and racial justice opportunities to really integrate neighborhoods, to build more cohesion, and to do it in a way that promotes all the things that we're talking about here. Another area where you might not think we are making a mistake is, unfortunately, in the area of solar power. So in a recent study in the United States, we used census data where we had data on people's incomes and where people live. And we found that if you look at communities and look at the racial segregation, that communities that are majority white or are majority no single majority, those communities are far more likely to have solar power on rooftops than Latino-dominated communities, which are 30% less likely, and in African-American communities, 60 to 70% less likely, even when you control for income. So we see, even as our existing policies to bring clean energy technologies into place, that our inability to seed companies in minority communities, our inability to think about ways to integrate solar into areas where there's more renters than homeowners. These are all challenges that a clean energy, pro-justice, pro-health agenda can bring into effect. And these are not lost. A really interesting and important series of studies by the Yale Center on Climate Change Communication found that in the United States, minority communities are far more alarmed, far more concerned, and far more engaged on climate issues than are those who have, through economic or other means, insulated themselves from the effects. And I'll, of course, come to the connection to COVID for that in a second, where we see very similar dynamics. So this really brings me to what my laboratory at Berkeley works on. We tend to call it solution science, which is a bit grandiose, because I would say we're creating more problems as a society than solving, but some of the upsides are really pretty exciting. Mayor Bloomberg in New York and the Sierra Club ran an incredibly powerful, a very illustrative campaign that highlighted that fossil fuel burning was a huge racial justice issue, and that, in fact, the lungs of children, and often minority children, were some of the frontline scrubbers, if you will. Very effective effort to think through how we make these messages more tangible and direct. In my own backyard here in the University of California system, we've been fighting to divest our portfolios, because after all, if you divest your electrons, but don't divest your dollars, something that Maria was highlighting, you haven't gotten there. And so this is an op-ed from 7 years ago, but just recently, the University of California system voted to divest. It was adopted by the regions. And so we are now the largest university system in the world to have divested from fossil fuels. It really highlights the degree to which good science, good analysis can lead into action. And that leads me to my concluding comments around COVID. So we're all addressing COVID in different ways. The United States is finding ways to do it as badly as humanly possible. But one of the things that we noted, and Maria highlighted in her comments, is that while our use of fossil fuels fell, that is not the way to run a transition. That's probably the most expensive, most divisive, most destructive way. But the lessons are clear. Our ability to now build back better and cleaner is one of the opportunities we have. And we're seeing that not just in the United States, but overseas. This is a campaign in Kenya to fight against a coal plant, which is not the cheapest plant to be installed on the coast of Kenya. It's far more expensive than the solar and the wind and the geothermal options. But international fossil fuel funding, primarily from the United States and from China, is pushing this coal plant in a country that has incredibly abundant renewable energy resources. In the United States, an effort that I urge any of you to Google and look up is a program called the Green Stimulus, which is an effort to invest in clean energy projects, shovel-ready projects to bring the types of things I mentioned: better infill subsidized housing, solar for rooftops of low-income communities. And just yesterday, the governor of California announced that we would now outlaw the sale of new internal combustion vehicles by 2035. I personally think this is a great start, but it's one that we're likely to see pushed forward, as we heard previously in some of the comments. And in fact, if you really look more deeply at the opportunities for electric vehicles, which are cheaper to operate, which of course don't pollute where they're driven, this is an opportunity for social justice as well as climate justice. And this is the kind of target we need around the world. Nick highlighted the targets in Europe. We're gonna hopefully push this forward, but it's the kind of start that gets us into an agenda of clean energy. And that brings me to a last and somewhat nerdy slide, but something which is remarkably lost in the conversation is that we have now several decades of data that investment in clean energy brings more direct and more indirect jobs than the similar investment in fossil fuels. So when you think about the opportunities to change this over, to make a green investment, this is one that countries that need stimulus, cities, communities that need stimulus can all invest in. And it's an opportunity to use the horrific crisis we're in to accelerate in precisely the way we need clean energy, healthcare, and social justice. So thanks so much, and I look forward to moving into our conversation.
Thanks, Dan, and thanks, Nick and Maria, as well. That was great. And thank you to those who started sending in questions, which I'm selfishly going to just start blending into our moderated discussion because a few of them are right on point with things I wanted to speak to as well. But first, I'll say a couple of quick things and also answer the most repeated question, which is, can we get copies of Nick's slides in addition to Dan's slides? And Nick has kindly said, yes, he will provide a PDF, so we will make sure that that is up and available. And we'll provide a link to Dan's website as well so that you can see these later. So don't worry, they're not going away. You can dive through them and pick through all the details later on. So very quickly, I'll say again for those watching online and those who've joined us, because I've seen the numbers, they keep going up as time goes on, which is great. My name is Melissa Lott, and I'm here with Dr. Maria Nira, Director of the Department of Environment at the World Health Organization, Dr. Nick Watts, who's the Executive Director of the Lancet Countdown and Chair of the NHS England's Net Zero work, and Dr. Dan Kamen, who's the Professor of Energy at the University of California, Berkeley, and the former Science Envoy at the US Department of State. So we're discussing environmental justice with regards to climate, health, and energy, particularly diving into climate change and air pollution. As we know, there are many more issues in this topic that we could dive into, but those are the ones that we're going to focus on today. We're going to open up questions from the audience in a bit. As I said, I will just go ahead and start blending some of them in though, so we can really have a good and diverse discussion. For those of you joining us on Zoom, you can submit a question for the panelists at any time by clicking on the Q&A button at the bottom of your screen. And for those of you who are watching the live stream from anywhere else, you can submit a question via Twitter using the hashtag CJEPLive and our Twitter handle at Columbia U Energy. And Nicolina and Caitlin will be helping me to sort through all that. So thank you again to both of them. I see that many members of the audience have already started submitting questions, and actually we had some advanced questions come in before the event. But if you haven't sent yours in, I would encourage you to do so now and throughout the discussion if anything really resonates with you and you want to dive into it further. I want to start this part of the conversation off with asking about each panelist's kind of personal observations when it comes to our local and global responses to climate change and air pollution. And Dan, you opened the story really in a great way talking about our response to COVID. I mean, it's clear from the data, Nick, you went through it, that we're not on track to achieve the Paris Climate Agreement ambitions of limiting global temperature rise to well below 2 degrees. Maria, you talk about the 7 million people who are dying each year because of air pollution. I mean, these are not the numbers we want to be seeing. So I'm curious what your perspectives are if you had to just hit some high points about where are things going wrong, but bigger, where are things going right that we might look to, and what can we do to get things on track? And Nick, I'll go to you first and then move over to Maria and then Dan next in that order, if you don't mind.
Sure. Oh, where are things going wrong? everywhere in so many different ways. There's all sorts of depressing reasons to depress yourself. It's not helpful. At a core level, what we have forgotten is that the environment is actually quite important. That the environment, it turns out, is actually everywhere, and we didn't realize that it was important or that it was everywhere until it started to change. It turns out clean air is important for human health. It turns out, nutritious food is important for human health, safe environments, safe cities. So fundamentally, what is wrong is that disconnect, right? Is that misunderstanding of sort of some of the foundations, really the foundations of public health. This is where public health began. It used to be about all of that. We forgot about some of that. Where are things going well, though? That's more helpful, right? Things are going well, I think, in a couple of areas. I remember when we started, it was ridiculous to think or talk about the end of coal. There's still a long way to go, and we mustn't claim victory just yet, but we have made some really remarkable progress in coal-fired power, and there have been impressive health benefits that have resulted from that. That has been unequal. Those benefits have been unequally shared across the world, and I think, Dan, you showed a few slides talking about that, which we need to be really cautious about. We can't make the same mistake the health profession made with tobacco when it comes to coal. There is also impressive progress when it comes to the healthcare system itself, the decarbonization of healthcare. It turns out that you can run a healthcare system or large parts of it online. It turns out you can send out 28,000 laptops to health professionals across the United Kingdom in the space of a week, and you can manage to get very high numbers of outpatient appointments and GP appointments running online, and you can provide excellent high quality healthcare in the middle of a pandemic. It turns out that is also good for the environment. So there are some really impressive things happening there. The thing that gives me the most hope, I think, is probably though, and Maria, well, when I started working on this, you could fit most of us around a small table at COP. Most of the people working on health and climate change around a small table. Some of the people that have been working on this a little bit longer, I suspect you could fit them in a small phone booth. That has changed now. There are 199 people coming to this call. That is remarkable. There are, I'm sure, many more people streaming on YouTube. When there was a call for evidence for the NHS on what a low carbon health system and net zero health system should look like, the response was deafening. It was so exciting. So what gets me really excited is that the health profession has woken up. And we are starting to see that engagement in the way that we use social media, the way that we engage online, the way that we engage at the UN and General Assembly. This is all data that we track as part of the Lancet Countdown. That's what I'm most excited about.
So I certainly agree with what Nick highlighted. I think that the fact that it's a much bigger conversation is a great positive, and I'll also stay on the solution side as opposed to just going back to say what's going wrong. And certainly the level of fossil fuel subsidy is the #1 direction it's going wrong. And just to put that number in context, globally, our fossil fuel subsidies are between $500 billion and $5 trillion a year, depending whose metrics you use. To put that in context, the entire global investment in green energy over the past 10 years is about $250 billion. So just the fossil fuel subsidies far outweigh the amount of investment. That needs to change. Certainly divesting our money as well as our electrons is the critical start. And so I would say, for me, the most positive actual signs are really the announcements we've seen. 2 days ago, China announced that they were still on track to peak their emissions before 2030, something they announced in 2014 in a famous event with President Obama. I actually think that China is likely to peak their emissions far before that, more like 2025, if they don't use the COVID emergency as a chance to reinvest in coal. And there are some signs that even with this historic announcement that China plans to be carbon neutral by 2060, 10 years after our hope for deadline, but not horrific, not like what I'd like to see, but on the path. But if this is a chance to reinvest in coal, that would put it in the exact opposite path. The announcement made by Governor Newsom here in California yesterday that internal combustion engine vehicle new sales would be off the table by 2035 is exactly the kind of statement to highlight that we are making the shift. I actually think that given the economics of clean energy and of electric vehicles, that we will likely be able to move that forward in time. So it's those sorts of cascading, positively competing announcements that are critical steps. And unfortunately, one of the victims of COVID, one of the many victims, is that the climate conference that the UK was going to host in Scotland this coming November has now been put off for a year. What that means is that if we don't find a way to leverage these types of announcements and start to chart their milestones city by city, country by country, region by region, we will effectively have lost a year in this dialogue at a point when we can't afford to do so. So one of the most critical things is to hold elected officials accountable for these sorts of announcements, to demand to see the data. We are in a big data, but not necessarily a big wisdom era, but to use that data to really highlight the degree to which we're making the progress that we highlighted on these issues. And I think one thing to highlight is that we hear a lot about initiatives in clean energy in California and New York, in Portugal, in Denmark, in Germany, and parts of China. But the only two countries that right now have been verified to be on pace to meet their Paris climate goals are actually two African countries, the Gambia and Morocco. And that is not part of the standard conversation about who has made those initial investments. And so we all know that where the big dollars are is where the chance to really make big opportunities and change, but to really highlight those success stories, those countries that are making the transition. Kenya, I mentioned, a place that's choosing today between more clean energy, more geothermal, solar and wind, or a externally funded coal plant. Those are all the places where we have a real chance to make this nexus of health, justice, and climate work.
Dan and Maria.
Yeah, I mean, I don't see anything more political than public health. I know that people tend to think that political is doing political parties, but public health should be one of the most important political ambition that people have, in the sense that politics means taking care of the community, the collectivity, and the health of the people. In that sense, it should be very political issue. And at the moment, we need those politicians thinking on the real well-being of our populations. And this is maybe one of the things that might not be going in the right direction, that we need the leaders now that will take us in the good sense of the politics that will lead us to this level of well-being and protection of public health. But since I am a pathologically positive, optimistic person, otherwise I will not be working on public health, I think there are many things that are going well. And Nick and Daniel have already outlined many of them. The European Commission decided to be more ambitious on their reduction of the emissions. And by chance is a woman, it's just a coincidence. I'm not saying that there is any correlation, but yeah, it's nice to see that. China has made a very important announcement, I agree. As Nick said, now we are many, and health professionals are more and more getting out of their hospitals, their healthcare facilities, and raising their voices in other environments and in other fora. I think what is going right is that hopefully the mayors and the people who has this local capacity to take multi-sectorial decisions, there will be joining the group, maybe for good political reasons, maybe because of the votes, maybe because we are raising the health argument that is becoming a very important driving force. But I think this is irreversible. It's a question of time, but I hope that now the way, I hope we will be able to judge the decisions that the politicians are taking now in terms of how many lives you are saving by taking the right decisions that you are taking. And Daniel, something a little bit, I'm afraid, disappointing is that on the other conference I was attending 5 minutes ago, a senior official from Kenya was saying that unfortunately on the stimulus package that they are discussing at the national level, unfortunately the energy transition was for the moment not included. So I hope they will correct that. Otherwise, COVID will be creating again and a step back. But again, we are all positive and pathologically optimistic. So let's think that this will be just a mistake and they will correct it as soon as possible.
No, I love that comment though on being pathologically positive, because I am asked so often how I smile as much as I do and how I seem to be this optimistic person. And I study, I mean, terrible things like people dying, realities of these massive disparities between communities, and they can seem like insurmountable problems. And my response is effectively, yeah, but we have tools and solutions, and I think we'll make it better. So I'm optimistic about it. I think we can take this in a positive direction, because it's not an unsolvable problem. It's just a very challenging one that needs to be hit from so many different sides if we want to get the speed that I think we need, et cetera. So I may have to co-opt that, Maria, because it's a more elegant way of explaining what takes me several sentences. So pathologically optimistic and positive about the future and what we can do and accomplish. Dan, I don't know if you want to make a quick response to that, or if I can move on to the next questions.
Yeah, no, I think Maria's exactly right. So one of the things that my laboratory has done is work with the Kenyan Energy Regulatory Commission to really highlight the economics of clean energy. And one of the ways you can really enable it is something we did when I was at the World Bank, which is we helped invest in a transmission line that would connect Ethiopia and Kenya, which is now energized, it's working today. And it essentially connected some of the geothermal resources in Kenya and the hydropower resources in Ethiopia so that they had a green energy backbone and did not need this coal plant that ironically would be the first coal plant in Kenya. It would actually be one that's placed in Lamu, which is a UNESCO historic site. Doesn't need coal, doesn't need coal imports. Coal is more expensive than both of the clean energy options I meant. And so when you see that being pushed in the national agenda, you know it's those external dollars, and I'll name names. They're from China and from General Electric are the two that are pushing that coal plant despite the fact that it's more expensive than the local renewable options. And so those fossil fuel subsidies have a direct impact on people's lives, health, and justice.
Thanks for that. I'm going to blend a number of different questions together. There's been a series of, I think, very important questions around how do we engage people from around the world, and then also what are some of the most persuasive pieces of data or messages that we have seen really being able to affect hearts and minds. So these questions came in from Adrienne Hollis. It's good to see you online. She's a senior climate justice and health scientist at Union of Concerned Scientists. And I think, Adrienne, we saw each other last at the US Senate when we could all meet in person and we were launching the US Countdown report. Also came in from Emma Krasovich and Portia. And so thank you for those questions. I'm going to put them all together. So I'm going to start with this one, and I'll phrase the two questions here in a second. Maria, if you don't mind going first, and then we'll go Dan and Nick. But effectively, what can we do to engage people around the world on this topic? Maria, you mentioned how often people go, wait, what? How many? The numbers of people? What are you talking about? Tell me that number again. And they're surprised by it. And the second question is, so how can we empower and engage across the world, across all communities, et cetera? And then have you all seen any pieces of data, excuse me, that have been particularly effective at changing hearts and minds of those who might not initially think that these problems are really serious or something we need to respond to? So Maria, I'll go with you first, and then again, Dan and Nick.
Yeah, we still, obviously, we have the traditional mechanisms. We have the ministers of health coming to the World Health Assembly. We are putting a very strong health argument. But I have to confess, and I've been working on public health for several years now, that it's still a mystery for me what stimulates the attention of our listeners when we use health figures. It's a mystery for me why, when you say 7 million premature deaths, people is not rushing and they say, oh my God, this is a national emergency, we need to do something about. While maybe one day you tell them that one of the ingredients of a food that has been distributed all around the world, eventually, if you eat it for 10 years, eventually will be responsible for an increase of the cancer in 20 years from now. And that will provoke in the media very high attention. So I'm still totally, a mystery for me on how to use those figures. We have 8 million deaths caused by tobacco consumption, and still people is not saying, okay, this is a national priority, that has to stop, and it's so simple to stop tobacco production, consumption, and distribution. But it's not happening. So it's still a mystery. Maybe we need to learn from the fossil fuels how they managed to get the fossil fuels so popular, so attractive, and still very much in the agenda until now. Data is always, of course, extremely important. More we have data on, particularly now for me, the critical data is quantifying the health benefits. So I will love to be able to offer any mayor who wants to do a campaign to win elections, say, okay, you can go outside telling people, oh, your city will be one of the best around the world. And you can say, if you vote me, in 1 year, I will reduce 20,000 deaths that are caused by air pollution. And I can be there to help him to monitor, him or her, to monitor those benefits. So for me now, the most powerful data will be not the one describing the negative of the scenario. People can be very reactive and insensitive to that, but how many lives you are saving if you reduce traffic in your city, if you move on having a public transport, which is very attractive and acceptable and feasible and cheap and all of that. How many cases of asthma are you reducing? And I think the mayor of London knows what I'm talking about because he's using very much this argument. And so making it politically attractive on a very good way. I mean, in the good term, sense of the political word term. So that will be for me the most powerful one. How to mobilize more people? For me, health professionals, I mean, those who are the credibility, the stethoscopes, the white quotes, and then that role, they should be less shy, as I am, and being a medical doctor, and then go out and influence everything. I mean, from the political decisions on the energy sources that the country is moving on it, to the election of a mayor if he or she was not able to do something about air pollution, and to raise their voices when they treat somebody with a lung cancer and then they send it back after the surgical treatment to a very polluted place, forgetting again a big risk of developing other diseases. Over.
Great, Dan.
Yeah, I mean, I agree with those. I think that there's a climate science story, there's a climate communication, there's a health science and a health communication story, and now there's finally a social justice, racial social justice, and a racial justice data story. And the scientific one is often how we think about how policy is made, but it's really the movements. And so the climate movement, the international health movement needs to and can embrace much more of these lessons. The fact that whenever we sit down and do a calculation about the climate benefits of a switch to clean energy, when we include the health benefits using DALYs or various other sort of nerdy quantitative numbers, the health benefits are always 100 times larger than the direct climate benefits. Now that's partially because we don't understand every aspect of the ecological impact. But in terms of regulators and politicians who are primarily concerned about the next election, highlighting that these are benefits you'll see immediately in communities: lower healthcare costs, the ability to have positive response around investing in sustainable, locally grown food. These are all things that have immediate benefits. And just like in that Mayor Bloomberg campaign around children were the air filters for fossil fuels, these are really efforts that generate the kind of momentum. And so we had in California, just on Monday, an announcement by Tesla that they were going to drop the price of their Model 3 by $10,000 down to $25,000. Still an expensive car for most, but that's a significant drop. And at the same time, that was happening because battery prices are falling, because the demand for electric vehicles is going up. That's a follow-on effect that helps to clarify that electric vehicles that 5 years ago were much more expensive. Now, in fact, they're basically on par. And if you really price out buying petroleum versus electricity, you get to a point where you can really see tangible, immediate benefits. And I think that telling those stories in much more public and popular ways has to be much more part of this health climate imperative.
And Nick.
Sure, there's not much else to say, hey? Two things matter. The messenger matters and the message matters. The messenger, we need to make sure we have the right person for the people we're talking to. So what kind of data matters and how do you, activate people? It depends entirely on who's telling them that, right? And often we may find that that doctors, nurses will be helpful communicators for some people, but there will be other people as well. There will be sort of faith leaders, there will be community leaders. And so making sure that we have trusted messengers, but a diversity of trusted messengers, I think is really, really important. On what those messengers say, it depends entirely. Sometimes it is economic data, sometimes it is health outcome data. To my mind, what matters is that we communicate with certainty, we communicate with urgency, we communicate with a number that is local, so I can understand what that means to me and the kid standing next to me with childhood asthma. And we communicate that there's a solution and that, hey, we're part of the winning team, that there is a transition that's underway. And yes, this is tough, but we are confident that 10 years, 15 years, 20 years from now, we will look back and we will be on the right side of history. If you get the messenger and the message right, I think you're most of the way there. The final thing you need to do is make sure you never get tired of that. You just keep repeating it. You go again and again and again. You find new ways to say it. You never get tired of your message.
Yeah, thanks very much for that. So Nick, you mentioned comments and discussions you'd had with Maria previously talking about how significant the Paris Agreement was for health as a health agreement, really. And so I'm wondering, okay, what do we need for you to move away from saying that was perhaps the most significant one to saying, it's probably number 2 now? Like, what does it need to look like, whether it's next year or the year after? What are the key components that we need to move to urgently? If you had to pick, I don't know, top 3.
Yeah, fair. I wouldn't want to trash the Paris Agreement, right? It's not perfect. There's plenty of problems with it, but it's the thing we've got, and I think we need to build around it and support it. What we need to see is more of what we saw from China. We need to see governments turn around and back up behind it. I would love to see. We're getting close to COP21, 18 months away, 12 months ago, whatever it is. I would love to see health right there, front and center in primacy. There are some really, really quick, good early wins around coal, around transport, that I think if you consider health and build them into the nationally determined contributions, there's some exciting things you could see there. Ultimately, we need some pretty powerful commitments on net zero. We need them to be credible and we need them to be equitable. There's a real concern here that sometimes we talk about net zero by, towards the end of the century or, somewhere in the middle. And that is fine for some countries, but not for Australia. Not if you are a high-income country that has got us into this problem. You need to be moving much, much sooner. Does that answer your question, or does it talk around it, Melissa? Call me.
Great. And I would love to hear Maria's comments on it, if you don't mind, Maria.
No, it's just that I was thinking that on the positive side, things that we can do to convene more and all of that, I think we need to do a favor to ourselves and simplify our message. I think we are creating so many slogans and initiatives and groups and all of that somehow we might lose our target audience. And maybe with one thing we would be, people doesn't know that climate change and air pollution, there is a big overlap, or the fact that when you are creating all of those movements around planetary health, there is an overlap. So I think we need to align all of those different groups at the risk of them going into, not on different directions, but diluting the power that all together we could have under a kind of, the airplane companies, when they create this association and you have a card that you can accumulate your points on that. I mean, I don't remember anymore. That was on a previous life when people used to travel. But I think we need to create that type of alliance among the alliance and go into clear messages and united message. Then you can focus on, if you are specialized on human rights, you go for that. You use the justice or angle or the entry door of energy. All the entries are fantastic, but I think we need to give the sense that we all are claiming the same things, and with different, obviously, benefits more than causes.
And Dan, did you want to jump in?
Yeah, I mean, I think actually the fact that almost no one recognizes that renewable energies are cheaper across the board than fossil fuels. I talk to CEOs of companies in this space, and they're not aware that in 2020, 2019, and 2018, the least expensive power plants installed anywhere in the world were solar and wind. And the fact that that comes as a surprise to people in the field makes it clear that people who are not in the field experts aren't aware. If that's the case, it makes many of these decisions much easier. We know we need to get batteries less expensive. We know we need to invest in more integrated solutions so that buildings, for example, in cities are not permitted unless they have solar windows. And right now, transparent solar cells are a technology that exists in the market. 5 years ago, it was a dream. And so I think that really highlighting these numbers, and I don't think a price on carbon solves these problems, but I do think that it helps to send the signal. And I would go a little further, because the price of carbon is one thing, but the social cost of carbon, something that integrates not only human health, but ecological health, that really drives it home. And I think one of the interesting things that's come out is that when the science and the economics community talked about this 10 years ago, there was a great deal of conversation that the price of carbon would have to be $150 to make a transition. And that was an incredibly simplistic reading of the models and the data. What we're seeing now is that what you need is actually just to balance out that incredibly large fossil fuel thumb on the scale of economics, that a small cost on carbon really helps to educate leaders, elected leaders, CEOs, so they can recognize that clean energy is the cheaper option today. And that really changes many of these dialogues. So that's really one place I would begin in terms of this economics, health, public communication around what we can really do very differently today.
So around those lines, on the technology line, I think that I've got a whole series of very optimistic people who want to talk about solutions, which is great to see. And it's just a whole host of questions about technologies and what technologies are going to, take us to this future we need. What do we need to be getting behind? And we've got hydrogen here, we've got batteries, we've got, I think, questions across, buildings, transport, electricity, and power supplies. I mean, it's the gamut. So Dan, this one's coming for you. So could you just kind of give us some high level points? Because I know when I describe this as like, what do we need? And I talk about decarbonizing the power sector, I say, well, there's 3 buckets. There's zero, marginal cost renewables, variable things. There's firm dispatchable power. So there's things that we can depend to back everything up. And then there's energy storage. And if we have all 3 of those things, we're talking about this low cost, affordable, and rapid transition that will give us a reliable system. But I'm curious, what's in your bucket? Like when you think about techs that are running but need to run faster, or that we're not paying enough attention to, I mean, what's all in there? Because and apologies to everyone who's sending these questions. They're fantastic, and there's a lot of them. So I want to make sure we just go through it.
Well, I mean, like I said, I'll post the slides and a couple of the recent articles where we did that highlight these economic numbers. But again, the fact that solar and wind have now been the cheapest, and not just in a couple sort of ideal settings, and around the world, we are seeing this as the low end. Energy storage today is improving or is dropping in price as quickly as solar ever did. And solar has dropped 90% in 1 decade. And so we're at a position now where you really shouldn't be thinking about building a new building that isn't integrating solar and storage. And in the markets in the world that are permitting you to sell power back, that ends up being a no-brainer. In the many, many markets that are preventing renewables and preventing energy storage from selling power back, we're seeing slower progress. So the mix of technologies that I would sort of put on that front line are certainly the classic renewables: solar, wind, geothermal, and energy storage. And today, solar plus storage, or wind plus storage, is cheaper than coal, except for where the coal is massively subsidized. So the economies are there. We just have to wake up to those opportunities. Now, that doesn't mean there's lots of things we don't need to do. We certainly need to keep the research push and the market pull to make storage cheaper. We need to make energy efficiency job one around the world because that's the cheapest form of energy, the energy we don't need to use. We need to take into account these health benefits so that the analysis done by city planners and by elected officials and by leaders of companies highlights all of those upsides. We also need to push much more on fuel cells because if we're going to bring hydrogen into the market more fully, we need to find those early applications, whether it's ships or trains or buses, and the effort that Japan and Norway have done to invest in all electric major ocean tankers is a great step forward. Those are the kinds of things we need. And so it's really that mix that is available to us today that will make it clearer and clearer to people in positions to make these economic choices. These are the better economic ones to go for.
No, that's great. And a related question that I wonder, I think all three of you could probably speak on this, is how do we make sure that in this forward progress that we don't trade one set of gaps for another, that we don't trade one set of injustices for another? And there's a number of different folks who have flagged in on this. We've got, a question from Michael Moore that focuses mostly on raw materials extraction because we're still building stuff. But it's really a number of different questions. So I would ask you to be liberal with that question and take it from your perspective and comment on it. And if you don't mind, Maria, could I start with you and then go to Nick and then Dan? And I think you just it's muted, so yeah.
Sorry. I was saying that let's start with Dan, who is our specialist on this area. But definitely, what I would like to put on the table is that more and more this discussion around different sources of energy, how this influence the economy, what are the decisions that politicians are taking in this. But the good thing is that more and more you have public health experts or health experts at the table, which is something that a few years ago it was totally out of question. And in fact, still at the country level, when you have maybe projects related to climate change or projects related to energy, it's very rare to have people from the Ministry of Health sitting at the table and saying, well, be careful, because if you do that, I still remember when on the climate change negotiations, somebody proposed the diesel cars, diesel, because that was good for reducing greenhouse gases emissions. Little detail, diesel was, not as nice for our lungs and our health. So this is the type of things, the health sector might not be obviously the expert to consult on which sources of energy, what are the technologies that will bring us to the new future. But I think it's fundamental to have the energy and health nexus and connections just to avoid these ad hoc measures that will have a clear benefit on something specific, but then as a whole, we will have other consequences. And on that, with a medical training, and Nick, I hope he will share this, we are trained to see the human being as a whole. You don't prescribe a drug without understanding that it might be useful to treat one disease, but it might increase the levels of, hypertension. You might have a hypertension, or you might have another problem associated with that. So you need to have a very holistic approach, and more than ever, we need that now to avoid this ad hoc, maybe opportunistic measures that will have incredible repercussion in the. So when people tells me on environmental impact assessment, Maria, you should be very happy. We are doing an environmental impact assessment on this project. And then, of course, health will be contemplated. I say no, because if you do a health impact assessment, then you will have as priority in terms of benefits, health up front, and in terms of speed for obtaining that those benefits, you will be the criteria will be completely different if you do it for environmental purpose or for health purposes. So, in health impact assessment, more interaction between the health and the energy people, or the transport people, or others, and then putting health as the criteria to decide on a holistic way which interventions, which projects, and which technologies.
Thank you for that. Nick, do you want to take it next?
I mean, the question was asked and answered. But
Great.
patient-centered care is the other sort of analogy that comes to my mind, right? As medicine evolves, it turns out that medicine shouldn't quite be driven by the sort of expert doctor who, you know, is definitely wearing a white coat, probably male, probably, you know, grew up learning medicine before a lot of the evidence was there. Patient-centered care says, no, turn it around, flip it on its head. This is a shared decision-making process. This is a process where all of the things we're doing, all of the surgery, all of the medicines we're prescribing, they are driven by the patient. They are driven with the understanding and the sharing of the patient. I think if we can take some of those principles and sort of build that into this, the more sophisticated, eloquent way of saying that is health and environmental impact assessments. My naive way is to talk about patient-centered care.
And Dan, do you want to?
Yeah, I mean, I think that, you know, part of the question really highlighted the larger life cycle of things. And so, you know, we all, or many of us have, oh, I'll have to stop my background so you can so you can see it. But we all have these devices, and we all need to recognize that much of the materials are conflict materials. A lot of the critical elements here are coming from conflict regions in the Congo and elsewhere in the world. And so our financial choices, both individual and large corporate choices, have very clear social and health impacts, and particularly on indigenous peoples, on women who do much of the smelting of the rare earths in our computers, our phones, etc. And so doing more honest counting of where these materials come from, and championing the campaigns that are trying to get conflict-free materials is a way to recognize how this is tied together. And this is certainly one of the opportunities where we can leverage clean energy for more social benefits. Mini grids in communities in the front lines in many conflict areas remove them from the trade in diesel, and they allow them to make different choices. And these are all parts of the opportunities that didn't exist before clean energy became so much less expensive. That doesn't mean we deploy it always this way, but we really have a chance to invest in healthier value chains for material goods, for food in particular, if we recognize these linkages.
So we're running close on time. This has been a great discussion. I'm going to do one more linking together of a whole series of questions that are asking, I think, from people who, you know, appreciate all the comments about what governments can do, but want to move beyond that because perhaps, and I might be reading into it, they're not, though some people have said this, they're not exactly confident that their government's going to do what they think needs to be done. So they're asking about, what can I do beyond voting and beyond those types of things? What can I do? And what can private companies do? The private companies we work for, the private companies we own shares of, these types of things. What can private companies do? And one thing I'll flag for those, because there have been questions about if we have any good examples of companies doing things, just because it's very recent, I would flag Google's recent announcement that they're going to shift to 24/7, 365, zero carbon electricity to power their operations. And this is worldwide. And, you know, if you think about where Google has operations, it's not just in places where this will be fairly straightforward. There are some complex things. I think about, you know, you have operations in different parts of Asia where you are limited in what you currently have. And they said, no, we're doing it and we're doing it fast. So I would just reference that announcement. There's others as well. But I'm going to go kind of backwards around the wheel. I'm going to start with Dan, then go to Nick, and then go to Maria for the last word.
Well, I mean, I think you're right on the money that I mean, Google is a good example. It gets a mixed range of press, but it did not only announce the 100% clean energy goal, but also they are the supporters of the program, of the campaign I mentioned, to highlight here conflict-free materials for their devices. So that's a linking of these issues. Unilever has been an incredible leader in clean value chains. We've seen a number of food companies saying that they were going to start by doing renewable energy on the tops of their grocery stores around the world. And this is an effort to not only build clean energy into their value chain, but actually to make clean energy available for local renters. Because one of the challenges, if you rent, of course, you don't own the roof where you can put solar. So hosting third-party solar is one of those innovations. And we've seen that come out. In California, Safeway has been a leader on saying 100% clean energy in their stores, and they can move to be a host for community solar gardens. So those are just some of the examples that I think we should really be holding up in this regard. But at the same time, places that refuse to divest, So I'm an alumni of Harvard, and they have voted against divesting, which just shocks the whatever out of me. It makes no sense to be on the wrong side of a historic decision. We've seen a number of very rich universities choosing not to be where their research tells them they must go. And so really, these are some of the clear opportunities, both on the good and the bad side, to really change our behavior.
Thanks, Dan. And Nick?
I get asked this question, or I ask this question about myself a lot as well. I think the answer I come up with is you should do the thing you will do. Climate change is difficult because it can paralyze you, because it turns out that climate change is everywhere, and hence the response to climate change has to involve pretty much everything. And if you're not careful, you academicize it a bit, and you end up, struggling to figure out precisely what I should do. You can talk to your friends at work. You can cycle to work. You can get your friends to cycle to work with you. You can ask a question in your company. It can be innocent, like, hey, what are we doing on climate change? Or it can be more pointed, like, hey, do we have a board level lead to do that thing on climate change? What funding do they have? How can I contribute? You can ask questions about pensions and divestment. You can look at, whether or not your company has a net zero plan, right? This is not just a thing for governments. This is a thing that every single company, every single community, every single city, every single household has to get to net zero if we're all going to meet the commitments under the Paris Agreement. So you can do all of those things, but the simplest answer is we should do the thing that tomorrow morning when you wake up you will actually do, and then do another thing, and then do one more thing, and eventually you'll have a whole heap of things.
Thanks, Nick. And Maria for the last word.
I think I will certainly agree with the previous ideas. I will ask the private sector just one thing. I mean, most of them, the big companies, are already moving into environmentally friendly policies, doing a lot of things on a corporate level. I will ask them to be not doing it for cosmetic reasons. Let me put it this way. I mean, I've been talking with some private companies that they have an environmentally friendly department or climate change department. And when I talk to them, some of them on private in the corridors, they tell me that they don't have interaction with the rest of the company. I mean, they are there to look for some initiative projects in order to make them look good, but it's not going into the real DNA of the company. So I will ask for being a little bit more ambitious on that, without, of course, saying that all the companies are at the same level. Many of them are very, very ambitious on the way they are moving into that. But I will ask them to have a very high level of ambition, because this is really a serious matter, so they should be. And in terms of private, start to learn whether your company, the company you are working on it, the pension funds, whether they are investing it on fossil fuels or not, and then promote the divestment. Then even at home, maybe your family or others around, they do the same without the knowledge of what that means. And as Nick was saying, take advantage of any opportunity you have every day to put a little piece of, make a little drop of water, because the ocean is huge. So we need any drop of water here.
Understood. Well, thank you all very much. Appreciate all of your comments, the prepared remarks at the beginning and the discussion afterwards. Very much enjoyed it. Thank you to all of our speakers, and thank you to the audience for tuning in and for sending questions, during and before the event. It's great to see that enthusiasm, and I hope that many of you will join us for the rest of the series. It goes through the end of the calendar year that we'll be hosting at the Center on Global Energy Policy. Again, today's webinar is one of a series of virtual events that the Center on Global Energy Policy is hosting as a part of Climate Week. And the series concludes today at noon Eastern Daylight Time with a discussion on food and climate change. For a full schedule of recordings, anything you've missed that you want to watch later, if you want to watch this one again, please know that it will be online. Just one big thank you again. Really appreciate it to everyone here on the screen and also behind the screen who's been making this all run so smoothly. Hope you guys have a good rest of the day.
Thank you.
Thank you all. Bye-bye.